we speak about innervation of dorsal surface of the foot. Look here, it is not so beautiful diagram. That is first, second, third, fourth, and fifth toes. Clear? That is nails. Yeah. that is dorsal surface of the foot. Dorsal surface. And now we said that sciatic nerve, nervus ischiaticus, it gives nervus tibialis and nervus peroneus communis. Both of them, tibial and common peroneal, gives cutaneous branch. Nervus cutaneus sura medialis, nervus cutaneus sura lateralis. They join together and makes nervus suralis. Nervus suralis surround lateral ankle and goes to lateral side as nervus cutaneus dorsalis lateralis. Clear? Nervus cutaneus dorsalis lateralis. It is from nervus suralis. Then nervus peroneus communis. Nervus peroneus communis. It goes into the canal, canalis musculi peroneus superior, and subdivides into superficial peroneal nerve and deep peroneal nerve. Two terminal branches, deep and superficial. Well, superficial nerve gives muscular branches for musculus peroneus longus and brevis. Common peroneal nerve, the same, supplies short head of biceps. And after that, nervus peroneus superficialis, it is nervus peroneus superficialis. It gives two branches, nervus cutaneus dorsalis medialis and nervus cutaneus dorsalis intermedius. Nervus cutaneus dorsalis medialis, it goes to medial aspect of the big toe, and the same, it supplies opposite sides between second and third. It passes this space between first and second, not supplies, only second and third. Here it is medial aspect, and here opposite surfaces. Then nervus cutaneus dorsalis intermedius, that is nervus cutaneus dorsalis medialis, and here nervus cutaneus dorsalis intermedius. Intermedial nerve goes to opposite side between fifth and fourth. The same, it supplies opposite sides fourth and third, and it gives branch for opposite side between second and third. If you ask me why two nerves supplies these surfaces, I don't know. But it is so. From nervus cutaneus dorsalis medialis and nervus cutaneus dorsalis intermedius, cutaneous branches goes to opposite sides between second and third toes. And what about these fingers? Nervus cutaneus, nervus peroneus profundus, deep peroneal nerve. It supplies anterior muscles, tibialis anterior, extensor hallucis, extensor digitorum longus. Then it continues to the foot, and here supplies flexor digitorum brevis and flexor hallucis brevis. And after that, it gives two branches, nervi digitalis dorsalis, and these dorsal digital nerves goes to opposite sides between first and second toe. They are nervi digitalis dorsalis from deep peroneal nerve. Clear? It is not so easy like on the hand. Here 2.5 radial nerve, 2.5 ulnar nerve. That is all. It is not so easy, and you need to prepare innervation of skin of the foot, skin of the leg and thigh. And short branches of sacral plexus. Some short branches, they are rami muscularis. Impossible to see, but they goes to this muscle, help me. Piriform
Piriformis,
muscle. This is
gluteus,
no
obturatorius,
internus, superior and inferior gemellus. They are twins muscles. Musculus gemellus superior and inferior, and musculus quadratus femoris quadratus femoris. Here it is piriform muscle, obturatorius internus, superior and inferior gemellus muscles. Quadratus femoris impossible to see. They are supplied by rami muscularis of sacral plexus. Next nerve, it leaves pelvis through suprapiriform foramen. It is absent here, but we can see superior gluteal artery and the same superior gluteal nerve. Nervus gluteus superior, it goes to musculus gluteus medius, musculus gluteus minimus, and musculus tensor fasciae later.
tensor fasciae later.
Next, inferior gluteal nerve, nervus gluteus inferior. This nerve, together with sciatic nerve, passes through infrapiriform foramen and supplies what? Musculus gluteus maximus and capsule of the hip joint. And last nerve is nervus pudendus. Nervus pudendus, the same passes through infrapiriform foramen, then it goes through foramen ischiadicum minus and goes to fossa ischioanalis. And here, pudendal nerve, it passes here together with internal pudendal artery. Do you remember? This is internal pudendal artery, and this one pudendal nerve.
No.
And pudendal nerve gives nervi rectalis inferioris, supplies musculus sphincter ani externus, levator ani, and musculus coccygeus. Then pudendal nerve goes forward and gives nervi pyrenei for superficial peroneal muscles, musculus bulbospongiosus, musculus ischiocavernosus, musculus transversus pyrenei superficialis. And also they give cutaneous branches for posterior aspect of scrotum or labii pudendium majora. They are nervi scrotalis posterioris or nervi labialis posterioris. And terminal branch of pudendal nerve, that is dorsal nerve of penis or clitoris, that is nervus dorsalis penis or nervus dorsalis clitoris. This nerve supplies deep transverse perineal muscle, musculus transversus pyrenei profundus, musculus sphincter urethra, and finishes in glans penis or in glans clitoris. The same in sacral plexus, we have short branches, nervi splanchnici. Splanchnic nerves, they are nerves which supplies inner organs. Rectum, uterus, urinary bladder, prostate gland, all of these inner organs in pelvis supplies by nervi splanchnici pelvini, pelvic splanchnic nerves. But we will speak a lot about these nerves together with autonomic nervous system. Today only names, that is all. Not necessary to answer what are their supplies and how they goes to pelvic plexus and so on, not necessary. Only splanchnic pelvic nerves, that is all. Your questions?